Hi, I'm Tamara Thomas,
And I'm Jackie Shrigley.
and welcome to another episode of Urban Health Weekly, where we talk about, stuff that's going on in the medical research community and how it intersects with our urban lives, right?
That's right.
Jackie, have you seen that show? I started watching the show. I didn't want to watch it, but it was a recommendation, and I have practically devoured season 2. It's called
Now you're hooked.
Yeah.
What's it called?
Dirty John Betty. So the first season is Dirty John.
Okay.
It's like these true crime stories that, and they turn them into.
Right.
So it's Dirty John Betty.
Okay.
So this season is about Betty Broderick.
Betty
That.
Broderick. I haven't heard that name in so long. But I was looking it up the other day because something came up. I was watching something and up popped this in my feed, something about Oprah. And they had this thing about Betty Broderick. I think I was like reading about like narcissists and all that kind of juicy stuff. Yeah.
It's on Netflix, and I'm up to episode 7. I apologize if this is a spoiler for anybody, but I have to talk about this because I sat and watched this slack-jawed because I was just like, how could she allow this to happen to herself? How didn't she see any of this? And I know it's always easy to be like an armchair shrink and stuff like that and say, how can you? But we've been divorced, so we know when relationships go bad.
Yes.
And that's, sometimes you got to just cut your losses and move on. But I was just slack-jawed because I was just like, how could she possibly think with all of this going on that he's going to come back?
Is that how it was? Is that the story?
Well, that's not the whole story. The whole story was, how her husband had basically used her all these years. She helped put him through school. I mean, it was loans, but she supported them while he went and was hobnobbing and pretending that he was, well-to-do and all this other stuff, and getting into the right circles and meeting.
Oh, he was climbing. He was climbing.
Right, exactly. Social climbing. So she's taking care of the kids. She's working part-time. She's selling Tupperware. She's doing whatever she can to keep them afloat while he's off doing whatever. They decide, okay, well, I'm going to strike out on my own. So they make the big investment. He gets his office, and she's like his ride or die. And she's like, you've got to do this and you've got to fake it till you make it and all this other stuff. So he makes it huge.
Wow.
And he kind of almost turned on her. I think it was in any event, like, I mean, this was like all over the news. You had to have heard about this.
I vaguely remember years and years ago, they were really hard on her that she had just like lost her temper and she had like killed him and killed his like girlfriend or wife.
His wife.
And the wife. And then I remember Oprah interviewing her in jail, and then they had her kids like on the Oprah show like once or twice. And then they really just made it look like she had no remorse, no anything whatsoever. And then years later, I remember her being on, and one of the kids said, my father treated her really badly in the divorce. And that was
it one of the boys or one of the girls?
It was one of the boys.
Huh. Okay.
That's what I remember. But that's about the extent of it. And I think it popped up in my feed because I was reading about like, narcissistic people and narcissistic men. And, so just in that little blurb that must have popped up. And the impression I get is that husband like had every intention of just like using her until, he was done. And then so I'm sure it was just more complicated than just her being nuts. That's the feeling I get.
Well, what happened was, he was gaslighting her for years,
Okay.
making her believe that he wasn't involved with the secretary when he was in fact involved with her the entire time. And he would encourage her, make her think that that everything was fine, that it was all in her head. That you're crazy, Betty. There's nothing. Bets, we're fine. Would you stop this?
Oh my
Crazy.
gosh.
A woman knows when things are different in the relationship.
Yes.
Like,
Yes.
they weren't being intimate. He was distant. He was a bit cold with her.
Yes.
And he's convincing her all the while that everything is fine. It's completely in her head. Meanwhile, he's making all the plans behind her back for how to divorce her and and maximize the assets. See, I think he knew that she wanted them to be back together. Despite all of that, all she wanted everything to be the way it was, which her friends kept telling her, you're not thinking this through.
That's why he married her, because she was somebody who could be manipulated. That's why he married
malleable. She never set boundaries from the beginning. She wanted,
he knew she was unstable, and he married her because he could manipulate her. That's what it was about. Nobody said, none of the other attorneys said, that's not really kosher. You shouldn't be doing that.
All the wives did. And he was just like, well, you should mind your business and you should worry about your own relationship.
So entitled, a super entitled guy, super entitled.
And he really believed that she had nothing to do with his success, that it was all him.
That's
the whole time, and that she was riding his coattails. And he would financially penalize her because she just had no self-control. She had no self-control.
Okay.
She would violate or restrain.
It was very easy. She didn't look good, and it was easy to make sure that everybody knew she didn't look good but he knew that about her. Right.
And then what I was questioning? I was questioning this woman. Now I know she was young and impressionable, and she was dazzled.
Are you talking about the new wife?
Yes, the new wife. How could you marry somebody who would treat their ex so shabbily?
I know how he did it.
Yeah.
Because he was such a smooth talker that he made her believe, and she was right for believing, that the ex was crazy, that the ex was a horrible person, and everything that she did, she deserved. And that he is just completely like this perfect guy, and he's the victim in this.
Yes.
And she was right to believe him, and that's why he's marrying the new one. Yeah. He married the new one because she believed him and saw him in the way that he wants to be seen.
Yes.
It's not a relationship of equals.
He was extremely cruel and horrible to her. And I think he drove her to
unhealthy people all around. Wow.
And I think he took advantage of her fragility.
Absolutely.
Hey, anyway, this leads into what we're talk about mental health. But first, let's talk about medical news of the week.
Okay.
So, 27-year-old woman, body shamed by her doctor, diagnosed with stage 3 cancer. So this young woman, she was experiencing stomach pain, and she lost 35 pounds that she didn't intend to lose. She was, a bit overweight, but she hadn't intended to lose that weight. She goes to see a gastroenterologist. The gastroenterologist not only does not want to run any tests, he says, that's great that you lost this weight and that you can't eat, because she couldn't eat, she couldn't keep anything down. She had pain, and she had this weight loss. And the doctor said, well, that's fantastic that you lost all this weight. And this is a blessing, actually. You should look at this as a blessing. Oh, I'm not going to run any tests. This is a great thing that you can't eat any solid food. I should note that this happened in California. I don't know if that had anything to do with it, but
I can't imagine in New York City that a doctor would have the nerve to do that and not cover themselves at least.
And told her that she doesn't look malnourished when she was concerned about the weight loss, Wow. And so she went to she was crestfallen. I mean, she was devastated. So she went to another gastroenterologist because she talked about this on her Instagram, her social media. And they encouraged her, look, go get a second opinion, go see someone else. Well, the other gastroenterologist diagnosed her with stage 3 cancer, and she had a humongous tumor inside there. So luckily she's fine. I mean, you know, they removed the tumor, they did surgery, and she's got the chemo and all that other, she's fine. But what do you think?
Talk about being like unheard, invalidated, dismissed, all those things. That doctor had to at least, you know, listen. Talk about not serving your patients. Wow. Wow, that's awful.
You know, they said that it was body shaming, which I agree. But I also wonder how much of it was that she was young and looked healthy, and this lack of information, I think, that gastroenterologists have about what the new face of gastric cancer, right? Because it used to be a person in their 60s that had cancer, and now it's people in their 20s and their teens with cancer. I wonder how much of it was that, well, she's this young, pretty girl. She looks great to me, you know.
Yes.
My wildest dreams would I imagine that she would need a colonoscopy or
young people don't look ill necessarily. Yeah, they're not thinking about the new face of cancer, like you're saying.
Exactly.
It didn't fall into his queue as to the usual.
Like, I wonder if she were 47 and she came in with that complaint.
Oh, I'm sure he would right away.
Right.
Yeah.
You know, for sure if she was 57 or 67. But, you know, that's the thing now, is that, do they have their antennae up for this now? You know, and I just wonder.
I'm curious to know how old that doctor was. Like, you know, that's my thought. Like, was he like an older dude? Was he like a young doctor?
I didn't say too much about the doctor, but he just said that maybe it's not such a bad thing that she lost weight, and categorized her not being able to eat as a blessing. I think she's also an actress, you know.
Okay.
But I just wonder how much of it is like the paradigm shift. Like, hey, red flags here. You know, and they're not seeing the red flags.
Sounds like fat shaming to me, though. Sorry.
Oh, it's absolutely fat shaming. It's absolutely fat shaming. But also, I wonder if she were older and she came in with those same complaints. It would be interesting to know if she were twice that age and she came in with that. If she were 54 and she came in with that.
Yeah, I would take betting odds that if she were 54 and came in with that he would investigate right away.
That's what I'm saying. I'm not letting him off the hook for the fat shaming. I'm just saying that there was probably more to that decision than just, well, she looks pretty and she lost the weight and she looks great. I think it's also, she's a young woman, just incredible. Ooh, so remember we talked about the Biogen Alzheimer's drug, Aduhelm?
Yes. Yes.
So
how do you pronounce it?
Aduhelm, I think it's Aduhelm.
Okay.
Yeah. Yeah. Well, so it got approved by the FDA. And then 3 members of the FDA advisory board, one after the other, quit because they're like, we didn't say that this drug was okay this drug should not be in market at all. The medical community, the Alzheimer's community, is up in arms. Well, they're kind of split, because on one side you've got advocates. It's about time. This should have come out a long time ago.
Right.
And then on the other side, they're saying that there's no way this drug should have come to market because of the because they don't think that it really works the way they're saying it does to clear the amyloid plaques. And B, they're finding instances where it's causing damage, like brain bleed and brain swelling, etc. So thoughts?
Well, as you know, my mom has advanced stage Alzheimer's that we know of. And I remember years ago, we took her to a neurologist for a baseline. And at that time, there used to be a med that you would give to people who are at early stages. And the idea was that it was going to extend the early stage and delay. And the neurologist at the time said, I don't think this drug's all that. What happens is you end up giving too much of that drug and holding on too long to the patient. You just keep over medicating the patient in hopes. And she felt like it didn't really, it was like a false promise. So she said, don't bother with it. And I'm a little concerned that that's what's going on here, that it's a false promise. And I understand that people are coming from the, the Alzheimer, they're like, please bring us something, bring us something. But if you have to get like PET scans and it's going to cost some ridiculous amount of money, I mean, who's going to be able to afford it? How is it going to be covered?
Insurance. I'm glad you brought that up, because now that the other thing that's happening as a result of this drug being approved, this Biogen drug, now the industries, the PET scan industry, and what's the other scan that they do? The spinal tap? Is it the
spinal tap? Okay.
Yeah. They are pushing now, along with the approval, that they should be covered as well, because
but those are so expensive, and then they're invasive,
but that's the thing, right? Because this drug has now been approved, they've hitched this wagon.
They've hitched to that wagon. Okay.
Yes, basically saying now we need to have these screenings, otherwise how will you know who to prescribe this to? So that's the new push.
Big machine. Okay, all right.
So now the big push. I mean, and this drug is $56,000 a year. That's a lot.
Wow.
Yeah.
Wow.
And insurance, I think, is going to pay for most of it. I think. I'm not sure.
Really?
Yeah. I don't know where that is.
If I felt, how I feel, if it was something that I thought was really going to do, if it really made a difference, if it could really extend your life or extend the quality of life, of course you'd want to do it. Yeah. But it doesn't bode well that everybody is, dropping out and protesting and feeling like this hasn't been properly investigated, or that the evidence and the statistics are a little thin. Nope.
Yeah. Yeah.
It's almost like a false promise.
Yeah. But patients are optimistic, and they're
sure. There's nothing otherwise. What is there?
Yeah. Yeah. Is that what it is? That there's really not a lot much else out there?
It's not really. I mean, there's things like enrichment, but there's really nothing. There's nothing. I mean, other than the one med that I forgot its name that years ago, but that's also for early stages. And then that just didn't really pan out. So I guess the idea is this new one really does do something. It really does delay the beyond the mild cognitive impairment.
Wow.
I mean, but that's controversial. People feel it was rushed right through the FDA. So there's so much money to be had. This is such a holy grail.
You know what I worry about? So they take this, because what happens a lot of times is these products are rushed to the market. They skim the cream off the top of the market.
Yes.
And then they worry about the fallout and the payoffs and the lawsuits after the fact. Right?
Okay.
Like
any number of drugs, fen-phen. I remember fen-phen would be an example.
That was right on the tip of my tongue. Fen-phen.
I remember that.
Everybody rushed for the fen-phen, and then all of a sudden, it's a couple of years later. I don't even know how many years later. It was like lawsuit after lawsuit.
That was a really problematic drug. We saw young people with all kinds of like vascular problems. I mean, just mind-blowing vascular problems. I remember when I worked at the hospital, that was just like, it was crazy. So yeah, they rushed that one through too.
Yeah. Well, I guess
so much money to be had.
Yeah.
And also, how do you know? Like I could see why people would want to have, something that's so high stakes, so emotional. Also, we don't know if the tangles are all there is, the tangles and the tau and and we don't know for sure. Sometimes people have that and they don't have dementia. So
Right. That's the other thing
It's
that they
still
were
not,
saying is that
it's still
there's
not
no
one shot
guarantee
deal.
that the amyloid plaques is the de
Correct.
facto, reason or the precursor to, yeah. So in late May, Naomi Osaka withdrew from the French Open after she was fined $15,000, you remember, for not
Yes,
fulfilling
yes.
the press obligation. Well, she said that she was dealing with, depression and wanting to maintain her mental health and so forth.
Yeah, and she has a history of being shy. People know that about her. I don't know how a young person does that at that young age, have to go in front of that army of, and speaking into a microphone is stressful. I mean, anxiety is not getting less.
Yeah.
More people are starting to, come down with anxiety, or it's starting to be recognized a lot more than it used to be, that a lot of people have anxiety. And good for her for, saying, look, I can't do this. And sometimes, they're not forcing things on her. That's the way it should be. I'm glad some people came to her defense. John McEnroe, the
John McEnroe came to her defense.
He did.
I'm shocked because he's always had choice words to say about the Williams sisters.
Oh, he has? Because he did mention that Serena was the greatest tennis player of all time. He did.
He
did
said
say
that. That's incredible.
He
Wow.
was on yeah, but he, he backed her up. He said that he just felt like it's, the machine. Well, he's coming from a tennis perspective of the machine of sport being so huge, that it could really crush somebody, and that they're so young, and they're asking a lot, and how much of this is really necessary anyway.
With social media, you're afraid to say the wrong thing, because one wrong thing and then the media jumps all over you, and then next thing you know, you get replayed over and over and over again.
Your worst moment,
right, exactly. Or something is taken out of context and it's misinterpreted, and then that becomes played all over again and over and over. With this whole cancel culture, there's no escaping it, and that's a source of anxiety right there. So you've
absolutely. How many dumb things I say dumb things all the time, my God. Yeah. And what are the odds that
but you don't have a mic in your face when you say it.
Correct.
You're not saying it,
pressure.
Yes. Online for people to read and copy, and then it ends up, and even Bindi Irwin, is taking a break.
Oh, really?
Yeah, okay. for her mental health. Yeah, absolutely. Because you get a lot of that mental health burnout. But I also think, and tell me what you think of this, I think that the pandemic has tremendously increased mental anguish and anxiety and depression.
I agree.
People,
Do you think it's increased it because of secondary COVID, or do you think it's because of just the fact that everybody has been languishing, which is like, we're all stuck. It's been such a divisive time for in the last few years, and we can't go anywhere, and
I think it's all of those things.
Fear and
yeah. I think it's all of those things. I think we are extremely divided as a nation and siloed. And by the way, no one talks enough about social media's role in this, but I don't want to,
okay, a story for another day.
That's a story for another day. Because what they do is they feed you more and more. It's like, well, based on this that you watched, we think you'll like this. And so what happens is
the logarithm.
Yeah, exactly. The algorithms.
Okay.
And it just brings you
algorithm. I said logarithm. Okay.
Well, that's okay. Further, further and further and further and further and further down these rabbit holes. And then people get siloed. And there's a certain sense of isolation in that. People are just like ready to snap, people are so wound up.
That says anxiety right there. That people are so on edge.
Well, Lizzie, she's seeing somebody right now for anxiety because, for a year there was no school, and
That's
You know,
so hard on
the
kids.
thing was very hard. The Zoom thing was very hard because they're at that age where they need to be socializing and they need to be around each other. And you know, we tried as a group to, you know, have like social time with the kids where they're all on Zoom. It's just not the same. It's
They
not.
really need face-to-face interaction. They need to be in the presence. Otherwise, it's just flat image. That doesn't
Yeah.
mean the same.
Yeah, yeah. So, you know, so that's where, you know, that people are depressed because they can't hug loved ones. They can't see loved ones. Maybe you've lost people. In the medical community, there's a ton of, you know,
CSD.
mental health. Yeah, because of, especially if you're a frontline worker, of all the loss, you know, not just of just people just dying every day and you can't help them in a sense of helplessness, but also losing colleagues. You're afraid to go home because you're afraid to bring this disease that you don't really know that much about to your family. You had people sleeping in their cars and, you know, staying in hotels and so forth. But the sad thing for um, for medical providers is they don't have HIPAA protections like the rest of us do because of the nature of what they do. So they can't get mental health help.
Really?
Yeah, because it could jeopardize their career. It could jeopardize their malpractice insurance. It could jeopardize their licensing. You know, their certifications.
So you can't show any vulnerability of any kind or that you are having difficulty. You can't
No,
show
you
that.
can't get help. You can't get help. I don't know if they're showing signs of it, but you can't get help for it if whether you are or not. And that's problematic. That the people that we rely on to take care of us cannot, are afraid to get help because of the stigma. They're afraid that their you know, co-workers are going to find out and look at them differently. They're afraid that if they see somebody, they're going to be found out. Um, it's just such a mixed bag of, you know, helplessness. I mean, what do you do with that? You know, you got anxiety disorders, depression, you got the bipolar, mood disorders, eating disorders. You know, I can, people have gained so much weight during
Oh, yes.
the
Yes.
you know, just eating their feelings. And by the way, going back to Betty Broderick, that was the other thing that they showed in the, she just kept eating her feelings. Every time she turned around, she's had food in her mouth, she had bonbons, she was just continually, and then she blew up, you know, she was just eating her feeling. And then don't forget about, you know, the schizophrenia and other psychotic disorders, you know. I mean, what do you do? Where do you turn? What can you do? You
Yeah.
know?
How are they? What's been, has there been more intake? I would think that it's making people who already have like low level, it must just be exacerbating everything, must just be magnified right now. You know, just anxiety is such a, it's such a killer. I'm sure it's just really stoking everybody's existing mental illnesses and making them considerably worse.
Yeah, yeah. It's funny because
Good luck getting coverage for treatment, by the way, other than maybe a little bit of talk therapy.
Really? There's no coverage?
Whoa, good luck with that. You get, you know of coverage because
I didn't think there wasn't. I didn't think there wasn't coverage.
Oh, there's no coverage. I mean, not, it's really shameful. The coverage is shameful. Like, for example, you might need first long-term talk therapy.
Mm-hmm.
You might get approved for 5 sessions of talk therapy.
All right.
But that's not necessarily, maybe that's for something that's emergent, but it's just anybody I know who has children with like significant neurodevelopmental issues or kids, that stuff's not covered by insurance. Sometimes medical aspects of it will be covered. For example, like a pediatric psychiatrist, if you're going and let's say your kid has ADHD, The medicine might be covered, but and within certain prescribed doctors, they might allow that. But if you want to get like behaviorist, if you have that stuff's not covered, you know, it's just not. It depends on your insurance. And even with your insurance, they outsource mental health as a separate mental behavioral health is under like they have a separate company that they outsource for mental and behavioral health. So for example, I think a lot of it also gets like lumped under like rehab for people who are going off to rehab. But if your kid has ADHD and, you know, all that gets put into one category and it's a whole separate other company and it's not covered by this big umbrella insurance company. They outsource all that stuff. You have to do everything separately. It's a different number. It's a different, it's different everything. You have to do a completely different website and these two companies can't speak to each other.
Why?
It's forms and it's really, it's a lot. It's a lot and it's not covered. Also, you know, just simple neurodevelopmental things, ADHD, Tourette's, OCD, autism, these things aren't covered. And I'm sure lots of people have like low level or have like sub threshold.
Right.
You know, anxiety is so pervasive now.
Right.
That, you know,
almost a catch-all.
It's a catch-all, right?
Yeah.
Yeah. Anxiety NOS. That's like an entry level sort of.
Oh, okay.
Yeah. That would be an entry level sort of diagnosis that covers really a lot of stuff because almost everything has anxiety attached to it. And yeah, so.
Wow. I had no idea. I assumed that these things were covered benefit. A lot of the providers, the mental health providers, they don't take a lot of insurances because I think it's so flush with business right now, they don't need to.
The best ones almost never take insurance. Mm-hmm. They just don't. And, you know, if you wanted to go, let's say to a behaviorist, let's say your kid has ADHD or, you know, which I'm familiar with, mm-hmm. $250 for a 45-minute session, not covered. Sometimes you might get partial coverage, but a behaviorist wants to see your kid every week, or they want to see you every week. I mean, it's not.
Are both of you covered under the 250 in that scenario?
Oh, sometimes they'll do a situation like you'll, you know, they'll discuss a little bit. Well, they'll discuss with the parent about the child in that situation. But you're not getting 2-for-1 coverage. That's not happening. You're not getting like both getting behavioral stuff in one session. That doesn't happen. It's just, you know, it's a bit of a shame. It's a big shame, actually.
That's a crying shame. Well, there's no wonder then that so many people are silently just in agony and quiet anguish. And
you have to fight for meds too, by the way. You have to fight for your meds. That gets to be problematic.
What do you mean fight for your meds?
Well, for example, if your doctor thinks that this particular medication is better for you, you're going to fight your insurance company, just like a classic with other situations. The insurance company has very strict ideas of what, you know, how the dosage of generic.
They don't want to do brand name.
They don't want to do brand name. They want you to take you have to try all the other meds first before you find the one that works for you and that they actually cover. You have to exhaust all other medications, and some of these medications aren't necessarily great. So you might have, for example, a kid with ADHD is going through several medications before they find the one that fits. You know, that's all part of it.
Wow. That's incredible. I'm not even sure what to say about that. I mean, I really took this for granted.
Ask any parent who has kids with special needs, or, you know, they all know it. They have to navigate the system. And, you know, that's especially good for people who have like good executive functions. If you have a parent with ADHD or executive function a little off, it's harder to organize yourself and go through this maze. They don't really make it easy. So it's a whole thing.
So only the most organized and tenacious.
Only the most organized and tenacious, and people with resources.
Yeah.
Right. And what you do is you can pay big bucks and you have some fantastic doctor who then also has a talent for advocacy. And then they set up, but it's very hard to get one person, even with a child study team, it's hard to get one person who's on point.
What's a child study team?
Oh, a child study team is, for example, let's say your kid has some learning disabilities and you want to get it evaluated through your school district. So your school district, you will request your child to have an evaluation. And so, for example, they run a bunch of tests and the tests unveil perhaps that your kid has some dyslexia. And then the child study team, they'll have like a social worker, the school psychologist. It's all through the school system, but it has to be the quality of the individual school system. So if you are in, XYZ town, that particular PS23 is the school district that has to perform the evaluation on your kid.
Okay.
And then you have to go through this whole process called an IEP process, where if it's like individual educational plan, you have to get your kid has to get classified. It's just the whole procedure. That's a story for another day. I mean, that just takes up, but separately, if your kid needs any kind of therapy, I mean, how does that go about it for you guys? When you need some therapy, will your insurance cover it?
For me personally, I felt there was a period where I felt that I really was going to lose it and I really needed to talk to somebody. And I didn't really ask, I started with trying to find somebody because it was during the pandemic and there wasn't, you're not going anywhere. You're at home.
Right.
So it's like trying to find someone. And I just couldn't find, with all these resources, I just couldn't find some place that, and also for me, I wanted to speak to a person of color.
Right.
And I just couldn't find that sweet spot of someone of color who would do it online, it was like, this whole list of things. So I never did it.
Okay.
But then
I heard online is taking off though. I heard a lot of therapy online is taking off.
Right. But, then you have to fill out this whole thing. And a lot of the questions I felt like didn't really apply to me.
Okay.
I wasn't in anguish.
Okay.
Some of the forms that you fill out, it's like, well, I don't really fall into that category. I don't really fall into that category either. That's, by the way, that's always been a problem of mine where I always overthink stuff. So it's, when I had to do the evaluation for Lizzie, it took me a week because I'm looking at this, I'm like,
oh yeah, I'm familiar with that.
Is there another category this?
Yeah, there should be in between always.
Yeah.
And sometimes there needs to be something in there.
Yeah. And they didn't really have that. So, so for me, it was even more, nerve-wracking because I'm like, well, I don't really fall into that category, but this doesn't really apply either. So I just never completed the process. I thought of doing I think one was called Talkspace. And then I got very close and then the hours didn't work out, because they wanted to do it at off hours. And I'm I'm working at that time. I can't just, drop what I'm doing.
Oh, that's another thing. Good luck getting that after school or before school or after work or before work. Yeah. Those are taken. Yeah.
So the person that she's seeing currently, what happened was, so I started looking for her and I kind of started running into the same issue. But a lot of the issue I was running into was well, we don't see children that young. Okay. And I was just like, oh, okay. So they would check all the boxes, but then it's no, sorry, we don't see anyone that young. Teenagers, but no kids. I was like, oh, that's okay. So when, I went to a pediatrician and she had her annual and I said, by the way, can you recommend anybody? Because I really think that she's got anxiety issues. And it so happened that she had someone in her office that she had coaxed into having, because there was an article actually that I saw that was very interesting, that pediatricians are not really seeing children for the bread and butter stuff anymore, but they're seeing a lot more requests for mental health.
Okay.
Yeah, that's what they're seeing. That they're seeing a lot of that now. And I asked her, she's like, I'm so glad that you brought that up. Here, let me walk you over. And so she had somebody in the office and
Oh my gosh, that's like fantastic.
I know, manna from heaven. And
yes.
she was like that she had begged her to come and put in some time in the office, that she really thought that it would. And that was actually her first day.
Oh my gosh.
First day. Yeah. So it worked out. So she sees her, online once a week. And, she works with her on, giving her like skills and assignments and goals and stuff like that. And it seems to be working. It's only been a few weeks so far, but I feel like it's helping me for sure. Okay. Well, but in any event, she's seeing this person, and I'm grateful, because it's giving her, I mean, it's still early, and I don't know how many sessions that we're approved for. I keep, not that I'm forgetting to ask her, it's just that she's trying to squeeze so much into that time.
Right.
I don't want to
take up that time chit-chatting.
I don't want to take up that time, exactly.
Right.
So I never get a chance, but I could just drop her a line and be like, by the way, how many of these are we approved for? And find that out. But it does seem to be helping.
I think that sometimes addressing something like a third party who's like them addressing, like a professional addressing something, it means something different than mom or dad doing it.
Right.
And sometimes that, like, or a teacher addressing it. Yeah. Mm-hmm. It can be, it just has different meaning to kids.
But just the idea that this little one just had anxiety, just kind of like breaking my heart, and then me and my anxiety, that didn't help any at all.
Oh no, it didn't. No. Yes. Nothing will give you anxiety like your kid having anxiety. Yes.
Well, I also think just the stress of, because everything was on me. You know what I mean? Like, you couldn't order anything. I know that sounds really posh, but you couldn't order any, because as a working parent, you rely a lot on like takeout.
Yes.
Someone to make your salads, someone to to make your burger, someone to make your whatever, and deliver it to your door. And all of that was gone. And then everything in the store was all bought out. So I had to bake my own bread. And then, gluten-free on top of that.
Oh, yes.
So I had to bake gluten-free bread. And then I had to make everything from scratch on top of my work. So
that part's no fun at all.
So my days just became, and then there was like no outlet for any of it, because you're trapped inside, So I spent the first half of my day cooking and washing dishes.
3 meals a day, is it 2 snacks? That's so awful.
And then I'm up till midnight working because I had to spend my day.
You were exhausted.
And then again, it sounds posh, but no cleaning lady, and so I had to do all of that myself. So it was, and I'm very anal about cleanliness in the house. And it was stressful, and I really thought I was going to snap, but things are getting back to normal. And I don't have to. I mean, I enjoy cooking. I don't like cooking when I have to.
When you have to, that's a whole different story.
Yeah, I like cooking because I want to.
It's such a grind.
Otherwise, I still have all this yeast and flour and all that, and also because I have to make my flour mix from scratch.
Oh, you have to do yours. I do.
It's not like you use the all-purpose flour.
No, it's not.
You have to
assemble it, and you have to refrigerate it. It's a lot of work.
So there was that. I'm glad that Naomi Osaka and Bindi
You brought that up.
people,
Yeah.
are taking their mental health seriously and saying, I need to protect it. So I'm stepping away from activities that I find, are
She
harmful.
drew a boundary and did a little, good for her.
Yeah. Yeah. I wish, more of us could do that if we even recognize that that's the thing. But she
And have that language. Yeah. Have that, know how to say that, have that language.
Yeah. Do you think primary care doctors should be assessing people more now for mental health?
I think so. I know, like, with my situation, with my mental health, the pandemic has been weirdly, like, good for me, but that's only because, I have, like, anxiety in terms of, like,
Social anxiety?
yeah, it's social anxiety. So now I'm not socializing. And then I don't know what happened. I don't know if it was just like, maybe I just needed a break. And so now going out is not I'm so happy to be around people. So, you know, I was probably less symptomatic, but when we get back to, I think for some people, for introverts, maybe it was like temporarily a little bit of a blessing, but a little bit, but it's still, there was plenty of anxiety. It just wasn't the social variety.
Yeah.
So,
where did you get started? Like, how did
I get started? I got started like years and years ago when I was like a teenager.
Oh,
I did
okay.
like some therapy, and then I got used to like calling, going to see a therapist, and then I got used to that whole sort of system. But when
so your parents did it for you first.
Well, when I was in college, I went to see like counselor, like at the college. And I remember like the counselor not really like,
Oh, God, I remember
tried
that.
all those like help. I did all that when I was like, like a teenager. And then when I got a little older, then there was a therapist who was recommended to my parents. And I went to that therapist. And then my parents had phenomenal insurance. Because my dad was an oil company person,
right?
And that was like like a 1980s package, and they don't have insurance like that anymore. And then when that insurance ran out, the therapist lowered her price for me, and I paid her, and she did a sliding scale because I was just a student, and so I saw her for years, and it was talk therapy. And now they would never cover anything like that now because it was so long. Talk therapy is the most expensive one of all. And it's psychotherapy in terms of like that old school where you go for men, long time. And, that's really for the wealthy at this point, that kind of therapy.
Right.
So she lowered her costs for me, but I don't know therapists who really necessarily can do that anymore. She was charging me like $20, like really like lowered it.
That's
and then
fantastic.
and then I would just, come up that I could come up, but that's like unheard of. I don't know any therapist. Once they do a certain amount of time, once they get to a certain level, they're like, I already did my charity work. Now I'm going to, my time is money, and, and there's too many people who need to come in. So
I remember I went after my brother passed away. I went to the health center, and I was seeing somebody.
Oh, so you went to the health center, right?
I went to the health center at school, at the health center.
At the school.
And what can I say? The first person was very unhelpful. His body language was like he was just
doing you a favor or bored.
He was taking notes, and he was like in the corner. He wasn't even facing me. He wasn't engaged. And I said that to him. I said,
wow, you called him out.
Yeah, I did call him out. I said, what am I doing here? Your legs are crossed. You're as if you're, protecting yourself.
He was doing his time and you felt like he was just putting in his time and getting his
notes. He's not even really listening to me, not actively anyway. And I said, what am I doing
awful.
Here? You're not, And he just kind of froze because I don't think he expected,
somebody to call him out.
Some young Black girl to call him out the way he did.
I know I didn't call out the college person at all. I was just like, oh, they're falling asleep. I'm not gonna like,
No, I wanted him to know where he was falling short, and that I recognized that he was falling short. Like I wanted
good
him
for
to know
you.
his body language was not conducive to someone who wanted to, wanted to help. And his lack of interest was apparent. So
All
anyway,
through
I
that
switched
body language. Okay.
yeah. Well, it was his body language. I mean, he was like this with his notebook and his legs are crossed and he's facing away from me.
Oh my gosh.
And I'm just like, dude, I'm right here. This cannot work. So I stopped. So that was, and here I am, I'm like with the tissue, I'm like dabbing my eyes,
Yeah.
and, because my brother had just died. And I just, so I didn't see him again. And I think I ended it early because it was just pointless. And I saw somebody else and she was wonderful. And she helped me so much to get back on track because I had to take a leave from school because I was just so distraught, that just imagine you're in you're getting into your second semester freshman year and you get a call from home that your brother died. It was just a lot, so I'm glad I survived it. But that really helped me.
Wow. Good for you that you said that. I would never have had the nerve. I
Oh
wouldn't
no,
I didn't have the confidence. Yeah, I didn't have the because I remember the school lady just like falling asleep and I was just like,
she was falling asleep.
Yeah, she didn't seem to be paying attention. The body language, the same thing. And I just was like, so then I just felt like shamed and embarrassed and I just didn't go back to her.
You turned it in on yourself.
Of course. Yes, absolutely. That's how I am.
Yeah.
Yes.
Yeah,
Yes.
I didn't see that as, I saw that
Right.
like, how dare you?
Well, now I would be like, what's wrong with you? Like, but that's what I learned later with the quality therapist. I learned to speak up. Yeah.
Oh, okay. And so this next woman was wonderful and she absolutely helped put me back on track and I was able to get back into school. And, my teachers were very, my professors were very gracious about giving me assignments and stuff like that to make up the semester. But it was a rough one. And I'm just really glad that I spoke up for myself. But then there was the other time I had some treatment because I was going through divorce number 1.
Nothing. Oh yeah. Those divorces. Ouch. They're so freaking painful.
Anyway.
Fun was had by no one during the divorce. God.
I know, and that was my first one. So in any event, that was it was a nice local man, and he laid it out on the table, and he was just like he was more like the woman that I saw in college. She was she listened and she repeated back, and she was like, "Oh, it sounds."
She did all the clinical psychology type things. Yeah.
And and you work it out in your own mind, etc. Right. This guy was more like, I think you need to do XYZ here, which I needed at the time too.
Very practical. Very
practical. He was like, it sounds like you've got XYZ. You need to do A, B, and C. And I think you should start doing it right away. And I was just like, and that helped also.
Yes.
So every style, depends on everything that's going on in your life. And, I was able to take what he told me and turn it into some action. And because I was really at a point where, I was suicidal. Yeah, I was suicidal. And that's when I knew I needed help. I would work and then I would come home and I would be in bed from Friday night to Monday morning.
Yes.
And I would just lay there thinking about ways to off myself, to spite him.
Oh.
Yeah. And I was just like, what am I doing? What am I doing? I've got to get some help because, you have an idea of how something should be in your mind and then it doesn't,
that's that distorted thinking.
Yeah. And then I started blaming myself for things that because he was very good at making me feel like it was my fault, his bad behavior. Yeah.
Pure gaslighting. That's torture.
Yeah. you know. And so I was, I was turning it in on myself because I was just so angry that I was just like, you know what? I should just off myself and then let him come home and find me that way and traumatize him forever. But then I thought about my family. How would my family feel, if I did something like that? And they don't have the means to bury me right now, So I said, I've got to pull myself out of this. And he was fantastic. He was fantastic. He called it out right away. And he was like, this is what you need to do. And I did that. And we ended up getting divorced. And that was one of the best things that ever happened to me. And also that took the stigma of shame, of, failure for relationships and all that. That took that away from me.
That guy he knew what he was looking at and did not.
Yeah.
He didn't buy into that stigma whatsoever.
Yep. And that really helped me, and I keep going back to Betty Broderick, if only she had somebody to do that for her and
tell her exactly the order in which to do things.
Yeah. But then there's also that thing that she was stuck in this cycle.
You were also capable of hearing it. You weren't
that. Well, because I thought that's what it might be, but I didn't have, an outside party to verify it for me. Because I was just going by what he was telling me. And he's like, you're crazy. You don't know what you're talking about. And this is on you. And I'll tell you offline the details of how that whole thing went. Actually, I think I told you this before. But, he was blaming me for his bad behavior. And it was crushing me. It was killing me, because I started feeling like, well, maybe there is something wrong. And then I was just having this
it gets in your head,
where I was like, well, how can this be my fault? How can this be my fault? I haven't done anything wrong. I don't understand how this is my fault. And so I'm having that internal conflict.
And you're confused.
And I'm confused.
They're confusing you. That's smoke screen.
Yes. And I'm feeling like a failure because the marriage is not working out the way I thought it would or should. And, it just took a mental toll on me. It took a serious, strenuous mental toll on me. I started gaining, a lot of weight, and, that was, anyway, so that doctor, he was the best and he literally saved my life, and, I dropped him.
The right help at the right time.
And I can't stress enough how important that stuff is, to have to seek help, know you need help and get help, because it could really mean the difference between, your survival or not, and I'm not just talking about the basics like food but the mental or psychological survival, right? Because that's important too.
The will to survive, the will to thrive, the will
and your
to
self-preservation.
Yeah,
absolutely. Yeah. So much so for that trip down memory lane. But saying all of that to say that therapy is good. You don't keep it in.
It made a difference in my life. It was life-changing. Yes.
All right, my darling. Well, it was
all right, my dear.
Talking to you. Thank you so much. And I will see you again next week.
All right. Ciao.
Bye.
All right. Bye.